Can you say whether you've had any discussions about paying that or not paying that?
I am not inclined to make any statement in that regard because it's an ongoing investigation. I don't want to jeopardize any investigations, and I will make no comment in that regard.
But that's not a police matter, that's a you matter. Can you say whether you would be prepared to pay that ransom?
I'm not, as I said earlier, I'm not going to comment on that because I think it's debatable whether it's a police matter or it's an investigative matter. But our position has been very clear and consistent. We make no comment on that. It's unfortunate. It's a blemish on the company. I take full responsibility for that. And I'm trying to figure out what is the best way to address and help patients and providers at this point. And that's what my focus activity is. I take responsibility from a point that I was the founder of this company. I worked pretty hard in the New Zealand health sector for the last 25 years. I still think I have a contribution to make, but that's something for after the dust settles, whether I'm the current or continue to be the CEO, or alternatively, what changes in HR or additional resources that we may want to add from external or internal to ensure that we double up on what we could or fortify our existing stance on what we do currently.
But you are open to not being the chief executive in the future once that dust settles because of this?
Look, I'm not unprepared to step down if there's a better person who can take and do a better job than I did.
The Privacy Commissioner's Office has told us that it believes that Manage My Health has been made aware in the past of vulnerabilities. Is that the case? Do you know? Have you been made aware
Yes,
of things like that before?
Look, this is a dynamic environment, in anyone in the healthcare or IT business will know. There are a lot of ethical hackers who try to unravel vulnerabilities and get paid for it. Okay. And that is a normal process, and they normally notify you, hey, there's a vulnerability here. Do you want me to show you? I'm an ethical hacker, right? So you got to be vigilant. You got to do what is known as, I don't want to get too technical here, but what's known as a vulnerability application penetration test regularly. And as the code changes, this is a very dynamic field. People will find new vulnerabilities, but we have a very rigorous quality assurance program. This was something we didn't detect even with our tests.
Because if we just hold up what's on your website now, this is on your front page, trusted by over 1.85 million Kiwis. Do you think that's still the case?
Well, that was in our website, and we are trying to explain to the market. I suppose, if you want me to dynamically change the number, I probably have to think about that. But we've got a lot of support from the sector. A lot of people have got a balanced view that this has happened, and what they want us to be is transparent, fix the issue, and deal with it in a sensitive and professional way to ensure that people are able to actually deal with the problem and learn from this.
You also say there, Manage My Health is a secure health portal. It's not anymore, is it?
It depends on what you mean by secure. Nothing is 100% secure. We are secure to the best of our knowledge, and we do all the professional tests which any industry assessment will make independently that we were a secure software. I'm a victim of the hack. Okay? My personal record is out there, right? And so is lots of my friends and families. I am deeply distressed that this is out there, and this has happened on software that our company has worked pretty hard to serve people. We definitely regret this incident, which is a pure consequence of a criminal activity. Cybercrime is a huge thing around the world.
There's some talk today that people might be afraid to tell their doctors things in the future in case this happens again.
Look, the doctor-patient relationship is sacrosanct. Just so that your viewers understand, nothing in the doctor's database, which is in their practice management system, and the interlink between that and management health in its core function has been shared or accessed, I beg your pardon, okay, or penetrated. What has been penetrated is a single module which contains health documents from a specialist referral, from discharge summaries for a particular region, and also um, uploaded data by the patient. And there's a function called health documents. That function was what was penetrated, and that function has anything you as a patient can upload, not what your doctor uploads. We're about doing the right thing and fixing the problem. That's what I have to say. Trust us, even though we've dropped the ball or we've had a criminal incident. You can, if I do an analogy, you can lock your house any way you want. But if someone is determined to somehow break the glass and smash the door and get in, he will. And cybersecurity is no different.